The following 3 video clips show a patient who's recently had an amputation transfer from bed to wheelchair with a pillow in the gap. This is what we call a lateral transfer. This is the most commonly used method of transferring patients who have just had an amputation. To begin with, 2 members of staff will assist the patient to carry out the transfer. This allows them to grow in confidence and increase their strength and ability. As time goes on and the transfer gets easier, the patient will then maybe only need one member of staff and then down to none until they can transfer independently by themselves. Before the patient starts the transfer, the therapist will place the wheelchair beside the bed. They'll put the brakes on, move the seatbelt out the way and remove the armrest closest to the patient. The wheelchair is positioned towards the patient's non-amputated side.
A therapist places a pillow over the wheel and any metal components to bridge the gap between the bed and wheelchair. With the patient sitting on the edge of the bed and his remaining foot on the floor, the therapists move in behind and in front of the patient. The patient places both hands on the bed, then leans forward to allow him to push through his remaining leg and arms. One therapist supports the patient's hips from the front, while the other offers assistance at the hips from behind. The patient performs a number of upwards and sideways lifts across to the wheelchair. The patient now has the confidence and ability in his balance to sit on the edge of the bed with minimal assistance. A therapist assists from the front, with hands supporting the patient's hips as before. The patient performs a number of upwards and sideways lifts across to the wheelchair. The therapists adjust accordingly, trying to avoid prolonged top-heavy postures. The patient has developed his balance, general strength and confidence in order to do this independently.
I hope you enjoyed the videos, and remember, embrace the differences that you have.